I can't stay silent anymore. Right now, I am furious with the American Heart Association and their brand new blood pressure guidelines. And let me tell you, what they've just released could have massive consequences, especially if you're over 60. Why am I so angry? Because these guidelines are becoming more and more aggressive every single year. And I've seen with my own eyes what overtreatment of blood pressure does to people. I've seen it in hospitals. I've seen it in clinics. Older adults, some of them over 65, 70, even 80 years old, coming in weak, dizzy, fainting, sometimes after a dangerous fall. Many of them on 2, 3, even 4 different blood pressure medications, and yet their bodies can barely cope. And here's what makes me furious. Instead of rethinking these aggressive treatments, instead of asking why so many seniors are suffering under these protocols, the authorities keep tightening the rules. The shocking new definition of normal. Let's start with the most outrageous part. The American Heart Association and the American College of Cardiology now say that a normal blood pressure should be below 120 over 80, not 130, not 140 to 120. And they're going even further. They now claim that even 124 or 125 systolic, that's the top number, is already elevated. Think about that for a moment. Yesterday, millions of people were considered healthy. Today, those same people are now labeled as sick. And once you're labeled as sick, guess what happens next? More doctor visits, more prescriptions, more dependence on pharmaceuticals, and less focus on what actually drives blood pressure in the first place. The real cause they don't want to talk about. Because here's the truth. In most cases, the real culprit isn't salt. It isn't a glass of wine here and there. The biggest driver of hypertension today is insulin resistance. This is backed by decades of research in the U.S., from Harvard Medical School to the National Institutes of Health to Cleveland Clinic. Study after study shows that when your body becomes resistant to insulin, your blood vessels stiffen, inflammation rises, and your pressure climbs. And what causes insulin resistance? Processed foods, refined carbs, sugar overload, a sedentary lifestyle. This is the foundation of the hypertension epidemic in America today. And yet, when you look at the American Heart Association's own website, insulin resistance is barely mentioned. Instead, their solutions sound almost cartoonish. Eat less salt, eat more vegetables, drink less alcohol. That's it. That's their big idea. No real focus on metabolic health. No serious discussion on reducing ultra-processed foods. No urgency about exercise and muscle preservation in seniors. Why the silence? And here's the million-dollar question. Why? Why would the top heart health authority in the U.S. downplay the #1 driver of hypertension? Could it be because teaching people how to reverse insulin resistance isn't profitable, but prescribing pills is? Think about it. Blood pressure drugs are among the most prescribed medications in the world. Millions of people take them daily, often for the rest of their lives. Every new guideline that lowers the normal threshold means millions more customers. That's not health. That's business. The dangers of going too low. Now, don't get me wrong. High blood pressure at very high levels can be dangerous. It increases the risk of stroke, heart disease, and even cognitive decline. But here's the paradox almost nobody talks about. Low blood pressure can be just as deadly, especially in older adults. When your blood pressure drops too low, your brain doesn't get enough oxygen. What happens then? Confusion, memory problems, dizziness, falls, accelerated decline. I've seen older patients come into hospitals after fainting, fracturing a hip, or suffering a head injury because their blood pressure had been driven dangerously low by medications. And yet, instead of protecting these vulnerable people, the new guidelines encourage even more aggressive treatment. The system is broken. This isn't just a medical issue. This is a systemic failure. We have a medical system where doctors, even the smartest ones, are trained to follow the rules from above. They don't always question where those rules come from or who benefits. And in the background, the pharmaceutical industry benefits enormously. This isn't a conspiracy theory. It's documented history. The American Heart Association has been criticized before for questionable alliances, including promoting processed food products in the past while demonizing natural fats. When you dig into their history, it's not the story of an impartial, science-based guardian of health. It's the story of an organization with deep ties to industry funding. The questions you must ask. So ask yourself, why are they lowering the definition of normal? Why do they ignore insulin resistance? Why do these guidelines almost always lead to more prescriptions? The answer is uncomfortable but simple, because we are living in a clown world of medicine, a world where the focus is no longer on healing, but on managing symptoms, endlessly, expensively, and often dangerously. What you can do. If you've been told your blood pressure is too high, here's my advice. Don't panic. Don't just accept the pill. And don't assume your body is broken. Start asking questions. Ask your doctor if your blood pressure readings are truly dangerous for your age group, or if they are being judged by overly aggressive standards. Start looking deeper. Are you addressing insulin resistance? Are you cutting processed foods? Are you moving your body, building strength, protecting your metabolism? Because the truth is, your health doesn't belong to the American Heart Association, and it doesn't belong to the drug companies. It belongs to you. So the next time someone tells you your blood pressure is too high, remember this. Sometimes the numbers are misleading, sometimes the guidelines are flawed, and sometimes the very people who claim to protect your health are part of the problem. But you are not powerless. With knowledge, with awareness, with the courage to ask the right questions, you can take control. That's why I make these videos, to arm you with the truth, to shine light on the root causes, and to show you that there is always another way besides endless medication. If this video opened your eyes, share it, because more people, especially those over 60, need to hear this message before it's too late. If you've made it this far, I'd love to hear your thoughts. Rate this video from 1 to 10 in the comments and let us know what you think of the content. Your feedback is essential for us to keep bringing you useful and relevant information. Don't forget to subscribe to the channel and turn on notifications so you never miss an update. Thank you for watching, and see you in the next video.